97.9, 105.5, KISS FM. Ed Sheeran there with Perfect. It's Liz and Big Papa.
And it's time now for the Slocum Dickson Medical Moment, courtesy of Slocum Dickson Medical Group on Burstone Road in New Hartford, 798-1500 SDMG.com. Adrian in studio. Good morning.
Good morning.
So happy day after Halloween.
Yeah, you too.
That's
a thing, right?
Yes, November 1st.
Well, you know what it is, and Liz and I were talking about it earlier, it's tough to get up this morning because everyone's like trying to recover from the sugar stuff.
Yeah.
Because nobody has any of their kids' candy. Oh wait, I'm gonna have to test that one just to make sure.
Yeah,
no,
okay.
It's fine. It's fine. No worries. But now we are in November, and that kind of leads into what we have today.
Yeah, so just to kick off the month of November, which November celebrates a lot of different health conditions, but one thing that we wanted to talk about today was it's Stomach Cancer Awareness Month, along with a few other cancers this month. So Dr. Jhandier, who's our newest gastroenterologist, is here to kind of talk about that and what the symptoms are. It's more of a cancer you don't hear as much about, so we thought it was important to bring that to you.
Dr. Jhandier, good morning. How are you?
Good morning, sir. I'm doing well.
So, unfortunately, I'm very versed in stomach cancer. My mom, Grandma B, just is in remission now because she had cancer of the inner abdominal wall. And so, this is absolutely hitting home for me. Talk to us about signs, because everyone has heard of breast cancer, everyone has heard of ovarian cancer and prostate cancer and skin cancer, but not necessarily stomach cancer. What kind of things should people look for or be concerned about when it comes to this kind of stuff?
Sure, thank you for having me here.
Thanks for being here.
Yeah, for sure.
So, one of these signs or symptoms of stomach cancer is patients start to present with notice that they are losing weight. If you're not trying to lose weight and you notice that you're losing weight, that's one of the earliest symptom. Other thing is they can have a left upper abdominal pain that can be persistent out of ordinarily.
See, my mom thought that she had pulled a muscle, and she calls it her cancer baby now. But she thought that she had she was doing like water aerobics and stuff like that. Water Zumba is what she was doing. She thought she pulled a muscle in like around her rib cage, and she's just like, oh, it'll be fine in a little bit, and it never went away. So like that, something like that. That's right in the wheelhouse, right?
Exactly. That's exactly where the left upper side of the abdomen patients will present with abdominal pain. That's not going away.
Yeah, so she went in and got everything tested, and they did some tests, and they're like, this doesn't look right. And then thanks to the fine people at Slocum Dickson, they were able to come to where they got to as far as diagnosing and whatnot. So something like that happens, and you hit a couple of these warning signs. It feels like a strained muscle or something in your rib cage and whatnot. Then what? Is it go see your primary? Is it skip the primary, come to see you? Like what's the best way to go about it?
Sure. I mean, the most important thing I would like to really stress is that please do not ignore the symptoms or do not brush off. Or history is very, very important. Many times patients even do not mention, thinking this is something as you mentioned. You gave a great example.
Yeah. And people just think, oh, it's nothing, it's fine. It's just kind of like I hate to say wear and tear, but everyone, people sometimes tweak something or whatever. Oh, it's just something I'm just kind of dealing with whatnot.
Brush it off.
But if with any cancer, the earlier you detect it, the better you're going to have a chance to beat it.
Absolutely. That's correct. You just have to be vocal about your symptoms and tell the doctor. If you do not even mention it, then it can be a big problem, thinking this could be just a heartburn or anything, and not mention. You can be in gastroenterologist's office for something else and not mention it.
Absolutely. And when she caught it, it was stage 3. So I'm just, luckily she brought it up when she did, because again, she thought it was a muscle pull or something. Right. And because of the amazing people at Slocum Dickson, she's in remission now, and the cancer center is incredible and whatnot. Slocum Dickson Medical Group on Burstone Road in New Hartford, 798-1500 SDMG.com is the the website. Of course, like them on Facebook as well. Adrian, you want to talk something about something in my notes about oncology?
Yeah, you kind of covered it too, just to let people know that when you come to Slocum Dickson, we have more than just the doctor you're seeing. So you can have your primary there. We have specialists like Dr. Jhandier and
That's what makes it so convenient. I'm sorry.
I know. Yeah, that's why you can just literally go down the hall.
Yeah,
right.
And then that's
the
best part. You go in to see whatever it is. If it's your, my primary happens to be what up, Silveraja. It just happens to be there. So if I need to go do labs, I can go downstairs. If I need to, go see, if I need to get something X-rayed, I can go. They can try to
really
work it out. You don't have to put your coat on.
No.
It's all within the realm.
Yeah, and so when you're going through something like cancer, where you can have a lot of your doctors right in the same location, it helps. We have oncology down there. We have a whole infusion room, chemotherapy suite where we can take care of you, do the lab work, do the radiology, all the different imaging that you may need. All right there, and everyone's talking to each other and
that's the big thing, the communication, because when you enter it into the system, it's not back in the day where even now, if you have to go somewhere else, you have to fax over the records and fax over this or send this or whatever.
Right.
It's all right there. Or worst case scenario, because everyone is under the same roof, it's a phone call.
Right.
Hey, talk to me about this. Or sometimes they'll even come into the room with the other doctor and do a joint kind of a deal. Yeah. And that's what makes Slocum Dickson so amazing.
Yes, yeah, we agree, and that's one of the things that's really important to our patients is this we call continuity of care, where we kind of walk you through all the stages, especially with a condition like cancer. So you can check out everything we have at scmg.com. We've got all our specialties, all our doctors there. If you're looking, and certainly like Dr. Jhandier said, if you feel something is not right, get it checked, please.
Absolutely. It is the Slocum Dickson Medical Moment. Slocum Dickson Medical Group on Burstone Road in New Hartford, 798-1500. And what was that website again?
sdmg.com.